In this morning's Woman's Doctor, cardiovascular disease is the #1 killer of women. That's why February is dedicated to raising awareness about heart disease and women. And a new study suggests snoring may be a bigger health threat to women than men. Snoring or sleep apnea is a contributor to serious health conditions such as high blood pressure, heart disease, and poor blood sugar metabolism. The main symptom of it is loud snoring, along with brief periods where breathing actually stops, often followed by gasping for air. But Mercy Medical Center's Dr. Timothy Doyle says sleep apnea may go undetected in women because the symptoms can be different. So Dr. Doyle is joining us now with more information. Good morning. Good to have you.
Good morning, Theo. Good to be here.
First of all, can you die from sleep apnea?
Yes, you can.
Really?
Yeah, there are many reported cases of sudden death, which obviously is something we want to avoid.
And it's an indication of what, though, if you're snoring?
Well, snoring can be an indication of obstructive sleep apnea. And obstructive sleep apnea has been linked to heart disease, hypertension, and diabetes.
How do we prevent this?
The way we prevent that is by early diagnosis and treatment. And I think there are many patients out there suffering from obstructive sleep apnea that have been undiagnosed.
Yeah.
And particularly in women, because women do not have, you mentioned the classic symptoms, loud snoring, stop breathing, and then sort of snorting and startling. Women can have very subtle symptoms.
If you snore, is it necessarily one of these things that's happening, or maybe you're just snoring?
In the study that was done, they compared patients that were just snoring with patients that had no snoring at all, and they found there was a very high incidence of sleep apnea in that group. And then they scanned their hearts and they found that women, in particular, compared to men, had cardiac changes, specifically increased size in their left ventricle.
Oh, wow. Okay, so what is the cure? What are we talking here?
Well, the key is going to your doctor. If you're snoring, if you're tired during the day, if you're sleeping 8 hours, yet you wake up feeling tired and then you're somnolent, you should go speak to your doctor about that. The treatment, there are 2 treatments. There are surgical treatments whereby we open up the airway and allow for better breathing. And the second is something called CPAP, which is continuous positive airway pressure. And both work very, very well, and in patients that receive treatment have dramatic results.
Okay, I have to ask you, because I'm single, so I sleep alone. How would I know if I'm snoring?
Well, and I think that's the biggest thing, is those that sleep alone, it's really up to you, a friend, a family member, someone. I have many patients that come in that say, hey, you know what, I'm tired all the time and my mom says I snore. So you really do have to have someone observe that.
Okay, thank you so much for coming in.
Thank
all right,
you,
and if you
Theo.
have any other questions or if you'd like a referral, you can call 1-800-MD-MERCY.